Hello, everybody. Welcome to the panel on non-clinical workforce. First, I just want to thank our sponsors and for UNC Center for the Business of Health and Healthcare Club for sponsoring us and having us all here today. I want to thank all of you for investing your time and energy to be here. I know that you have a choice. You have an even bigger choice right now while there's another breakout going on. But thank you for being here, particularly because we are all very acutely aware we are what's standing between you all and lunch, and so we will have a good time today. So my name is Sartin. I currently have the privilege of serving as the Vice President of Operations for a company called Vituity. It's a large physician group, democratically held, multi-specialty. And I think the reason that I was invited to join this panel today and help moderate it is because I was the first non-physician asked to join and lead a practice line in the organization. And so as we see emerging trends of non-clinical workforce becoming more and more prevalent, the skills and what's required to make that successful in business, we thought we'd have an expert panel come and join us today and talk about some of their experiences. So I'm going to hand it over and let them introduce themselves. So, Geoffrey?
Sure. Good morning, everyone. Geoffrey Roche. I have the privilege of serving as the inaugural North America Director for Siemens Healthineers, leading workforce development. And obviously, I am also non-clinical. I am the son of a nurse, started my career in hospital administration, and have worked predominantly in hospital administration, leading service lines as an administrative dyad leader, and had a clinical leader that was my counterpart. And then also led other departments, and happy to talk through that. But at Siemens, my work is all about helping our hospitals and healthcare systems at a national level in the U.S. and Canada to build a future-ready, sustainable workforce. And obviously, I have a clinical counterpart. She's actually here. Carnisa is my colleague and she's clinical. And we have other clinical colleagues, as you would imagine, on our team. But we're really focused on that, and so I'm so happy to be here. And let me just say, I met students last night, and I'm so impressed, obviously, with the acumen and the passion that all of you bring into this work. And so I get excited when I see our nation's healthcare future leadership.
Sorry. Somebody had to do it. All right, my name is Ariane Cayrol. I'm super glad to be here. I'm originally French, so pardon my English if sometimes I just go off trail. I am currently a partner at Implement Consulting Group. It's a originally Danish, but recently local consulting firm in transformation and strategy. Where can I start? I started in consulting, my career at the Boston Consulting Group for a few years in France, working in large transformation in quite big pharma organizations, and then transitioned to biotech. I have experience in the world of corporate development, strategy, operations. I'm also non-clinical, but have had the privilege and chance to work with a lot of clinical people, particularly in biotech. And again, thinking about how to combine the clinical and the non-clinical skill sets and knowledge to ultimately deliver better care for patients. So super happy to be here.
All right, hi, good morning, everyone. My name's Tommy O'Connor. Thanks so much to Kat and to the Keenan Flagler School for having us here. I currently work with UnitedHealth Group, so I'm CEO of our Medicare business for a fairly large portion of the eastern U.S. It's about 1.1 million members. I'm also an adjunct professor at Gillings. I just joined there. I'm very grateful for the atmosphere here, and I've been with UHG for about 16 years, and over that time we've grown from 40,000 employees to 400,000 employees. And over that time I've seen a tremendous amount of growth in both the clinical and non-clinical workspace. I lead a team that is both clinical and non-clinical, have a lot of physicians, former nurses, pharmacists on the team, as well as MBAs and folks in the middle. So hopefully I can provide some insight and some of the trends we're seeing. So thanks so much.
Thanks, everybody. We're really happy that you're here. So I'd like to get just a quick gauge from the audience just to see what are the types of people who have decided to join this session here. So could you raise your hand if you're a clinical worker or a healthcare provider? A few, yeah. And then non-clinical workforce. Students. Got it. Thank you so much. I really like the mix. Well, our hope for you today is that you can walk away with something tangible, something tactical that you can hear, learn, possibly implement, but get a better sense just on the ground level of what's happening. Some of the earlier sessions really got to talk about the challenges or the future, and I feel like we sit really nicely square in the middle of things that have been successful with, I mean, it's growing, right? The non-clinical workforce is growing, and what are we doing now? What are we seeing now that is making that successful? I'm realizing in this moment that I think we are the humans in the loop, so it could be that we're all helping train that system. So with regards to that, as seasoned leaders, all of you have had the opportunity to experience the types of people who thrive in environments. Could you tell a little bit about the skills and attributes of people who are successful, and then specifically, what types of skills would still be relevant as the workforce continues to move forward?
Tom? Sure, I'm happy to get that. First, it sounds like if anyone gets hurt or sick, you're supposed to go over in that corner, right? Okay. But I'll first hit on a couple of kind of hard skills that I see are incredibly important in healthcare, and then just a couple of other more attributes that I think are becoming more important. The first is that having comfort, and even more than that, proficiency in big data, working in analytics, that's just kind of table stakes in healthcare now. And so I would just kind of encourage, if that's something that's your strong suit, really lean into that, because wherever you're going to land in the healthcare journey, you're going to need to be very comfortable doing analytics and excelling at that. And if that's not your strong suit, you haven't yet graduated. So let's make sure you get a few more classes in that. And I'd say another element that is incredibly important, that might be more of a trait, is change management. And I'll reference a couple of examples. What we're seeing on the payer side, on the provider side as well, is that the people running healthcare systems today are not the same people that were running them 3 to 5 years ago. Out of the pandemic and in this climate of change, we're seeing new CFOs coming in, new CEOs, new chief nursing officers, and they're not looking to keep the status quo. They're looking for an incredible amount of change to reinvigorate health systems. The payer side is doing the same thing. We're working in the value-based space. So there's a tremendous amount of change happening, and getting comfortable and adapting into that environment is really helpful. I'll note that I think the clinical workforce, generally speaking, is far more adept at doing that than the non-clinical workforce. And I'll give an example of that. Typically when I see a lot of our non-clinical workforce coming in, highly trained, lots of degrees, they say, well, here are these scenario plannings we're going to have, and everything is basically up and to the right. We're going to grow in this way, everything's going to be great. And when it doesn't happen that way, there's not a lot of scenario planning or aptitude for handling a down cycle or handling bad news, handling when something goes wrong. So something that I think we've learned a lot is that the nurses that are on my team that have been nursing for 20 years, the physicians that have been practicing for 10 years, they're able to handle that change much more fluidly. And so I think that those are some elements. So, beef up your analytical skills, and then really get comfortable handling down cycles, change management, because that's really what it takes in this environment to be successful. So I'll start there.
Maybe to complement that, completely agree with the change management side of things. I think it's completely true in the systems and industries you mentioned. My background is more in biotech and sort of development. I think also being comfortable with uncertainty. There's a lot of uncertainty in today's world at a macro level, but also at a corporate level. So knowing how to plan for that. You talked about scenario planning. I'm huge on sort of program portfolio management and thinking through that, both from a sort of hard skill perspective, how do you do that, but also from more of a soft skill, change management, communication, bringing people on board and helping companies sort of navigate and transition through that uncertainty. And I think, in today's world, whether it's consolidation, just new trends, technology, there are so many new things. Just scientific advancement. There's so many new things that are coming on that we need to take into account and consider and sort of use to move forward. That I think those traits are particularly important. And agree that we see some clinicians having that level of resilience of being grounded, having dealt with obviously multiple personalities, tough situations, and I find in, again, my environment of more biotech and consulting, those folks to be extremely helpful to bring that sort of grounded mentality and mindset in the teams and sort of complement some of the more business or sometimes sort of more forward thinking and some of those strategic mindsets of also some of the other non-clinical workforce. So definitely value in having the both work as a team, but I would say across the board, those are skills that I find are very important, becoming more and more important.
Yeah, so what I would add is, first of all, the most important skill that you can bring as a non-clinical workforce professional is listening. We have to listen to our clinical workforce. We wouldn't have burnout the way we have in healthcare today if our non-clinical leaders actually listened to our clinical team. That's the reality. As somebody who spent a decade in hospital administration, what I saw is the difference of leaders who listened, cared, empowered, and supported, and those who really didn't. They've always thought they knew the answer, and then we had challenges. The second, I would say, for all of you, students especially, is the power of networking and the power of truly building out what your authentic voice and finding your purpose and your passion is most important. In my career, what I have treasured the most was my mentor, who was my CEO, who was a nurse, so I worked with a clinical leader who coached me to understand these things, was you're going to be in space at all times in healthcare where you're going to be having that like 6 degrees or less than that separation, where somebody knows somebody else that you know. Just last week, I was in New Mexico with my colleague Carnisa, and we're sitting there with the chief nursing executive of Presbyterian Healthcare, and I'm sitting there and I'm like, oh, I wonder who else I know. So before I went, I did my homework, and I realized that one of the presidents I was a fellow with back in 2014. So as soon as I got there, I said to her, hey, John still works here, right? She said, yeah, let's grab a picture. She sends it to him, and John's like, he's here? Those types of connections. Later on that evening, I said to her, hey, you worked at Orlando Health, right? Did you work with this individual? She said, yeah, I know him. I called him on FaceTime while we were at dinner, right? And we both were talking to him. Those things are super powerful because what it also shows to that person is authenticity. It's not just a professional relationship, but it's a personal relationship. The final thing I would say is you have to realize that if you're asked to take on new assignments, you never know why then, but it will be powerful in the future. If somebody said to me that I would be working at an organization like Siemens Healthineers back in the early day of my career, I would have told you no way. And I'll tell you why. Because my opinion of med tech back in that day was not a place where I wanted to serve. But I'll tell you what changed. Back in 2020, I had a pacemaker inserted for a medical issue. And I realized at that time that I wouldn't be living to this day if it wasn't for a medical device company. And if it wasn't for that clinical and non-clinical workforce who each day are solving and enabling breakthroughs in medicine each day. I also wouldn't still be doing what I do now if it wasn't for a company like Siemens, because they're the company that allows cardiac ultrasounds and allows all the imaging diagnostics that allows us to enable breakthroughs in medicine sustainably. And so you never know until you face something in your life that may open up your eyes to an opportunity. And so just keep that in mind and always just follow those dreams.
Good job, guys. The relationships, especially with all stakeholders, we can all agree that they're so important and there's so many different ways to tackle it. While we represent the non-clinical workforce, there are so many other layers and people that participate, especially with our clinicians. So I think that's just an underpinning for everything that we're all going to be speaking about today. So we talked a little bit about some of the skills and attributes that are of the future, what's working today. Let's switch over to some of the roles. What are the actual types of titles, roles, positions, responsibilities that you all are seeing emerging that maybe didn't exist 5 to 10 years ago?
So I can contribute from a hospital end, right? If you look at the growing role is almost always going to be on the ambulatory side, right? And when you think about it, one of the biggest growth roles, oftentimes done by somebody who started as clinical or as non-clinical, is running a practice. When you look at the growth of physician practices, the practice administrator, the practice managers in those respective areas. In fact, even in the imaging space, we're seeing a trend where people who actually lead imaging are not always actually a technologist. They may be an administrator who understands the importance of running a department, the importance of leveraging performance and those types of things. And so what I'll say from a hospital end and even at a company like ours, right? If you look at our function of education and workforce, it was built by a technologist. She's a clinical technologist, now our global head of strategy and customer services, and she lives in the Triangle. People should be super proud of that. Somebody who built something at a global company and now is at a global leadership role, and we're incredibly proud of her. But the reality of it is that we have more and more people who are not clinical that are working in non-clinical roles. The other roles I would highlight that we're seeing that is think about hospital at home. Think about post-acute. Many of the leaders in that space, yes, you've got clinical people who are doing the clinical things, but many of the leaders of the actual functions are actually non-clinical. And there's various roles in that. Performance improvement, many people are not clinical. Analytics, many people are not clinical. You're seeing continued growth in those respective areas. And then don't forget about the startup space. I mean, we want to talk about a booming space that has a lot of people who are coming in with dreams and aspirations to truly transform healthcare. And I think oftentimes we always think, no, you've got to be clinical to really understand it. No, you need to know how to hire good clinical people. But if you have a way to know how to do something different, those are spaces as well.
And completely agree. Very well said. I'll offer two that I see are one's kind of growing. One I think is transforming. I'll put it that way. The product space, being involved in product, and that's a very broad term, but having a consumer-centric mindset of how does this work? And I'll give an example. In the Medicare space, we're trying to build out an industry-leading app for a population that I think has kind of been cast aside as, folks that are, over 65 or over 75, they don't use their phones. Yes, they do. They use them a lot more than all of us do. And so you need to have the same specifications, the expectations that you would have with a Delta app or with a Marriott app or anything like that. But that has to link to the actual product. How does it look and feel when you go to the dentist to seek dental care and you're saying, you can use your card that's on your app to pay for all this and finance it? Well, the fintech has to be built out to make all that happen, and the UX has to be really solid. So that takes a combination of people, like we have dentists on the team that are building that out, along with people that are just really into marketing, UX, can build out a tech stack, or people that are just very process oriented. So that's probably the fastest growing space. And I see that not only in the payer space, but also in the provider space as well. This product that we're trying to create that leaks into value-based care. The other one that I think is maybe a little controversial, but strategic fill in the blank. That's I would like, what is a company doing that's not strategic? So I think, yeah, exactly. Like someone's like, I'm in charge of our strategic accounts. I'm like, well, I feel bad for your friend who's in charge of all the other accounts, So I would just kind of take a little caution around that, like something that's strategic. How hard is that? I would look at what that work is actually doing. So if it's really an M&A role, then focus on M&A. If you're focused on account management, get really good at account management. But there's a lot of softness, I think, and that's growing in the space around anything that's labeled strategic something or other. I say that as someone who was director of strategy for a long time. So.
No, I think those are all great examples, and I maybe want to emphasize a little bit the startup side of things, which is sort of where I've been exercising in the past few years. I think what you said was very true. Like some people feel like they need to be clinicians or to start a company, and I think what I'm seeing out there is that's sort of not less and less true, but what I see more and more are sort of founder teams that are a mix of clinicians, scientists, and business people. And I know so many examples where, at least one of the founding member is somebody that comes typically from a pure business background, obviously with the knowledge of the industry, with the knowledge of the people that are required to build that company and to be successful, but with bringing that more operations, business, financial landscape, because the way I think about startups and just companies in general, it sort of starts with the patient, with the clinic, what happening on the ground, what are we trying to solve for, what's the need. It ends with the patient. We're obviously trying to improve the care, the patient outcome, the treatments, the technologies, the devices, whatever it is that we're working in. But in between, there's so many pieces of a very complex puzzle that need to come together, and that's both clinical and non-clinical. You need that clinical to keep in touch with the patient, with the need, with the care, with what we're trying to do, but there's definitely a lot of critical non-clinical aspects to it to actually have something that is operational, has a good strategy, is financially sound, is compliant, is just top-notch from a technology perspective. So I think all of those elements require also to bring the non-clinical workforce into the picture. And actually, I think it's more about getting the right partnership, and to your point again at the beginning about listening, understanding what each of us brings to that picture and how we complement each other and form that hopefully well-made puzzle at the end of the day, because we all bring something different, I think, to the picture. So that's really what I've seen in sort of the startup biotech landscape, and I think those are things that are more and more valued even by investors. Great, you have a great idea, but this needs to be a business to actually move forward and eventually be able to deliver the care that we want to those patients. How is that structured? Do you have the skill set to actually do that? A great idea is not sufficient anymore these days. So those are things that I've seen, and I think where, again, a partnership with the clinical and the non-clinical workforce are extremely successful.
I should add too, I forgot, and I'm sure both of you would agree to this too, is if you look at the biggest growth of a role post-COVID, during COVID, is Chief Supply Chain Officer. And I'll tell you an example. HCA is a perfect example of this, and I heard this from an HCA executive. I never had heard this story fully, and I'm not saying this to be political, but back in 2020, we knew there was a shortage of ventilators, right? And HCA had purchasing power. And one of the things HCA did is they went out with other countries, keep in mind, other countries, and purchased ventilators from other countries. And then they were in a position, smart on their part, to actually sell those ventilators back to the federal government, because the federal government wasn't prepared at that time on the ventilator situation, and they were able to help other hospitals get those ventilators, other VA hospitals, et cetera, get those ventilators. That role and that function has now become one of the most strategic functions in a healthcare system. It's also the space where med tech, we've got to work with chief supply chain officers in those areas. At Siemens, we work with them all the time. But that role now has become a much different role because it's about performance. It's certainly about better managing finances, but then also how do you leverage the partnerships, which is very, very important for all of you too to always think about, is there's no way to do healthcare at all, whether it's payer or provider, without the level of partnerships. The future is all about partnerships. So those roles are super critical. And I look back and think, oh my gosh, we used to call it materials management or purchasing, procurement, but the reality of it is truly transformational, those types of roles, because if they can make it work, the impact is phenomenal.
Let me kind of build off of what you all have just stated for us today. So as we see clinicians and in medicine becoming more and more hyper-specialized as it grows up, right? What about the non-clinical workforce? Do you feel like, and I'm going to wrap this into a more succinct question as I think out loud on it, but for the non-clinical workforce, are you seeing, and especially with the migration and transitory of roles, people are moving quickly from role to role as business is thriving, because ideally you are making money and you're growing and providing more opportunities for folks. So do you find that credentials or any specific licenses or specialty credentials, the MBA, are relevant? Do you need, it's a dangerous question to ask in a business school, but talk to me a little bit about the specialization or generalization of the non-clinical workforce.
Yeah, so taking that example of product, that has evolved into, well, there's a policy that goes into the product. So we need folks that are, have masters or PhDs in policy. That policy drives, the guardrails of what your product can look like. But then a huge piece of the product is just the business intelligence around it. How is it performing? That requires a lot of statisticians to do that work. So being proficient in stats, having credentials in stats, you can be incredibly influential in product. The other element that's more emerging is the experience piece, which is less credentialed but of greater value. I would say, so much of the waiting for HCAHPS and for the CMS star rating process, and so much of the expectation on value-based care is that the person at the center has a good experience. There's not really a lot of credentialing I can point to in that, but I find that if you excel at that, the product works better than all of the others. You can have the best business intelligence, policy making, but if your experience is not solid, then it's likely going to fail. So those are some of the areas. I'd also say something that's increasingly important is just the digital marketing aspect of what the product looks like. So I know that can be a derivation of what an MBA might look like, but the marketing folks are having a larger and larger voice as we focus on things like Net Promoter Score, NPS. That's really influencing a lot of relationships, both on payer provider all across the board. So looking at those like lesser looked at areas, I think is incredibly important.
It's a little hard for me to answer your question very specifically, again, given my background and what I've been working in. I would say maybe a certification or degree, the way I see it, sort of positions you more in, this side, that side, this function, and kind of gives you a starting point. But I really agree that, at least in my experience and what I've been, valuing and I think been valued for, again, being a French person with no American degree whatsoever and yet being here, is the experience. I think it's the experience, it's the track record, it's the people that I've been working with and that I've demonstrated that I've been able to create impact and value. I think, you said we're in a world of partnerships, of network. I think, to me, these are things that I would say beyond the obviously certification that sort of sets the starting point has allowed me to personally progress much faster or in different directions, allowing me to pivot from where I was from a career perspective. So I would say, just if you have a passion, just get started there, but then really think about how do you create impact, how do you build this network of connections, of professionals. Keep learning, for me, is the most important thing. Don't stop wanting to learn, and it can happen very quickly. You can get very comfortable in a job and just think, oh, this is great, I know how to do my job. No, try to do something different, do something else, leverage your network to try to go further, because that will give you the experience, that will give you the knowledge, the ability to navigate uncertainty and to just make even more of an impact. And again, coming from the world of startup, where it's really interesting because the profiles of people that are looked at are not only are people that have done this, but have built something. And I think that's not necessarily the same profile as people who've run something, and maybe sometimes they're compatible and sometimes they're very different. But it's again, I would emphasize, try to do as many different things, gain experience, find your passion, and sort of follow that and use that to continue growing your career. So that would be my take. There are obviously certifications that allow you to be, more expert at this and get you into a given field. But I really, in my personal life and experience and opinion, truly fundamentally value experience and references and, the network.
I have a unfunny joke that I like to recite around the higher up you move in an organization, the more we all become HR generalists. And so it really becomes so much about leading and managing people and talent and retention and the culture. And so maybe one day we just all have SHRM certifications or something. But that is something that you can always invest in and never fully see the return on, because it's, I'm sorry, you will always see the return on is just people management and culture and building teams. That's just something lifelong to continue to seek. So let's transition a little bit over to, so Geoffrey, you mentioned clinical workers working in non-clinical spaces. No, you said the opposite. Non-clinical workers entering clinical roles. We also are seeing a huge transition of clinical workers who are taking non-clinical roles based on a multitude of environmental factors, right? Post-pandemic, burnout, provider shortage, increased administrative responsibilities. So as you see this, as a recent study was even saying that over a quarter of clinicians are considering moving into non-clinical roles, and that there's really less than 10% joy in medicine anymore, which is super sad. But let's talk about, what are the gaps, the challenges, the opportunities? What are you seeing that works well when clinicians move over out of the front lines per se and more on the non-clinical side?
Yeah, and before we get that, let me just say that I personally wouldn't get a SHRM certificate until they bring diversity, equity, inclusion back into their mission. I have a personal pet peeve that they removed equity. You can't do this work without equity, especially in healthcare. But and I told SHRM's leadership that. But the reality of it is, to your question, is I think one of the things we have to absolutely do for our clinical individuals who come into particularly leadership roles is we have to make sure that there's adequate preparation from a leadership perspective. Far too often, we put clinical people into leadership roles and we just throw them in, but we never actually really make sure that they have what they need to be able to do what we know they can do if they get that support and training. This is especially true in hospitals. If you look at actually even it is clinical, but it's still leadership. If you look at like nursing, for example, we often put nurses over other nurses, but never really give them an opportunity to train them and prepare them for that huge opportunity. What is it like to manage a multi-million-dollar budget? What is it like to manage a big, multi-diverse workforce? What is it like to be responsible for working with supply chain on this and that, and pharmacy and this and that? So that's the biggest thing we have to do. Let me just say, though, that I think we have to understand that we are in a healthcare space that will always continue to change. But what won't change is we'll have non-clinical people that are over clinical people, and we'll have clinical people over non-clinical people. The world has just changed dramatically. You'll have dyads, or you'll have some type of situation. So back in my hospital days, for example, I was the dyad administrative leader of the EMS service line. What did I know about EMS? Nothing. Was I an EMT? No. Was I a paramedic? No. Did I know what they did? I went on the rigs and got to experience it, but I didn't know that. But what I did know was I knew the importance of their relationship to our emergency room. I knew the importance of their relationship to us from a strategic standpoint, right? And I wrote the business plan to acquire the ambulance company. And so I had some connection. But I had to hire a good clinical leader who could be my clinical counterpart to do what needed to be done in the clinical part while I could do the administrative part. But we were a team. Everything we did was as a team. I do think, though, that we also have to understand the value that a clinical person brings into a non-clinical role, while at the same time we have to do a much better job of talking about both clinical and non-clinical earlier. So in K through 12, we have to do that. In fact, I was talking with a healthcare system, Baylor Scott and White, recently in Dallas, Texas, about the fact that in their career-connected high school, they're going to actually be talking a lot about supply chain and other non-clinical roles, because just like the clinical shortage, we've got the same thing on the non-clinical piece. So we have to do a much better job of talking about the roles and the opportunities. But those are some of the thoughts that I would share.
Yeah, I'll also just add, as someone who works a lot with MBAs and a lot of physicians and nurses, kind of the way that I see these things play out a lot, and I'm generalizing, and I realize I'm in the MBA school, so I'll be kind. But it's like, folks that have a business-oriented background say, well, I can plan that scenario out for you, or like, here's what the model says. Ooh, I don't like that model. Let me tweak the model. Here's how, and they're kind of hedging against being wrong. And that's definitely helpful because we never want to repeat history that doesn't work. But then physicians often say, well, here's the absolute answer. This is the answer. Here's the ruling. And then we're like, well, where's the person with the nursing background? It's like, well, they're actually getting it done. So what I find is that a willingness and an aptitude to go and get the work started and done, that's incredibly valuable. And I find myself going back to that work mentality time and time again. That seems to be more inherent and transitions incredibly well from a clinical to non-clinical mindset. I do think, though, something that I find, generally speaking, harder to train up is the idea that being right is not always going to work. And particularly in complex health environments, and value-based care is a perfect example of this. Everyone at the table is right about what they're saying. The data's right, the strategy's right. But it's more needing alignment around what's going to work and reinforcing that, having aptitude. And I find that can be a more difficult skill to develop around, well, that's the answer, that's what the evidence points to. Yeah, but that's not going to work in this scenario. And you kind of have to swallow a little bit of pride and work through the idea that if this is what's going to work for the other party, then I can meet them at that space. And so getting those concepts right while not being shy about jumping in and getting started creates a great leader in my perspective.
No, yeah, I mean, you guys have said it all, so I'm not going to be very long, but it's really funny because I was just this morning in a conversation with a former colleague of mine who was a cardiologist who transitioned to become chief medical officer in biotech companies. And so I mentioned this to her, and I was like, well, it's interesting. I'm participating in this panel. Like, what was your experience when you transitioned from the clinical workforce to a non-clinical role? And she said, well, two things. She said, I thought what was really good was that I could bring sort of this intimate knowledge of patient care and what needs to happen on the ground and how actually care is given from a clinical standpoint and bring that value. But what was really hard for me was to navigate the more structured organizational complexities of being in a more structured company. And she had, she was like, I had experience leading groups and working with different teams, but it was at another level when I joined the industry and I didn't feel as prepared as I could have been. So there was a little bit of a understanding how to navigate this at the beginning, and to your point, how to best deliver the value that I could bring to the table. So I think those are very, very fair points. Also, exactly what you said around, well, I think I know, or I know what's best for the patient, but also acknowledging that now when this is in a company's context or systems context, there might be other considerations that make it harder or that require compromises from a business perspective, and being able to meet all those groups in the middle to find something that works for all parties. So from a more practical, conversation I had this morning, I think all of that was actually completely true.
Some of the earlier panels talked about team-based care models, and I think what we're almost referring to is like a team-based care model on the business side of it and how you have to interplay. Personally, I'm partial. I really like the dyad model. I think that brings the voice of the clinician, it brings the business acumen, it brings together different types of skills, and being able to have shared accountability and shared responsibility and shared goals to bring that all in can drive success at a maybe a slightly faster rate than folks who are frontline workers who are just wanting change to move quicker, right? But only have so much control of what they're able to accomplish. But then moving over into a non-clinical role on the business side, partnering with somebody and really seeing the outcome as things get executed. So I think that's really fascinating. I want to move over into just kind of the thing that we all join healthcare for, which is the ultimate mission and care for the patient. So coming in, it is, it is such a noble profession to be a part of, and every single component has meaningful value, and we're all here for meaningful reasons. But as we become further and further removed from the patient as business leaders, I'm very curious. I think it's really important to tell everyone how you personally remain connected with the patient, the ultimate end user and beneficiary, the patient, and then maybe what some of your companies or organizations do to keep that top of mind.
Yeah, absolutely. It can be so easy to just distance yourself more and more from the actual care that's being provided. I'll give an example. Actually, in North Carolina, one of the highest performing ACO groups, when we have our regular joint operating committee meeting every quarter, everyone stands up, and we meet in the break room because there's so little square footage that it's all for patient care, and everyone stands up, and it's like, whatever you need to say, this meeting can be 15 minutes. So the lead physician is there, who's the president of the practice, and we walk through everything, and he says, what do I need to change? Where are we failing? Oh, you're failing, or you're trailing, I should say, in breast cancer screening. Well, and then he points to his team, I need you to leave and go change the system. It's so real time, it's a little scary. But, that's an extreme example, but that is so connected to the patient care that I feel that inertia, and it's fantastic. It's so far removed from where we're at now, where I think a lot of the value-based care, ACO programs, everyone running those, they're at home, right? They're at home and they're looking at spreadsheets and they're doing risk strat, and you got to get out of that mindset. The way that I stay connected is a couple of ways that are helpful. One, right now, we have a lot of member meetings. So these are folks that are eligible for Medicare, considering plans. We go and meet with them, and it's 30 people in an IHOP that are trying to figure out what they want to do. And you sit down, and they say, "Oh, you're from United? Let me tell you why you guys are the worst." Or like, I had this, and they understand the product better than I do. And it's so humbling, but then you work through it, and I actually take that feedback and change products based off of it. And another way is we have regular consumer feedback, Net Promoter Score surveys. That's direct verbatims where, every leader I think needs this. And we make calls on a regular basis. How are you satisfied? What are you dissatisfied about? And all those verbatims, you read them. This works really well. This does not work well. And that live feedback and connecting with people is incredibly helpful to make sure that product is right in the center of the user design.
Yeah, so I'll say, I'm really blessed to be in an organization like Siemens because our first value as a company is we listen first. And so that is very intentional. I mean, I've been in our healthcare systems with our global CEO, Dr. Montag, and seen how intentional he is as we're walking through a hospital, not just to talk to our customer, but also to engage with patients. I have been, even in my time at Siemens, at many different hospitals, and that's what you see. Both at hospitals and even in our academic community with our students and faculty. I think one of the things that we've done, though, to your point, to be very intentional, and Carnice is leading this, and I'm not trying to embarrass her, but she came up with this idea that we need to train as many people in North America as possible on the power of storytelling. And that as a part of storytelling, we need to infuse stories of what we're doing to serve our customers and our patients and leverage those stories to impact enabling breakthroughs in medicine sustainably. And so one of the things that Siemens does as part of a commitment we have to improve access to care is we've got a mammo truck and soon a lung truck that go across the country with partnership with healthcare systems to deliver access to care to individuals that don't normally have access to care. These are individuals that are getting first-time mammograms and in the future first-time lung screenings. We partner with hospital systems. Locally, Wake Med has had this in the past and others across the country. And then we take those stories, and I'll tell you a story of a mom who was receiving her mammogram in South Carolina. This is a mom who'd never received her mammogram before, never had access to care to receive it, didn't feel comfortable receiving it, but because this big truck with amazing team from Siemens and the hospital pulls up into a lot that was like a community, she felt like, you know what, I'm going to do it. So she did, and the team helped her through it, eased her concerns. Well, while she was there, her daughter was there. Her mom is someone that worked in a factory her whole life. Her whole family's worked in a factory. So while mom is receiving her mammogram screening, they're talking to the daughter about all the excitement that one can have working in healthcare. They're showing her different machines. They're talking about the role of a technologist. So after mom receives her mammogram, mom comes out, and her daughter says, "Mom, guess what? I don't have to work in a factory anymore. I could actually work and provide care to this team in this type of a role." So we take those stories and we share them in a very effective way. When we go out to our hospitals, we're engaging authentically and genuinely. We're asking questions. We're meeting patients. We're asking them, hey, what's that experience like on that Siemens piece of equipment? And then we're taking that back. I was somewhere recently where someone that was disabled said to me, "Do you truly understand whether your equipment is actually equitable?" And I sat there and I thought, she has a very, very good question, and I cannot sit here and tell her that her question, I could answer it right now. So I took it right to our product leader in North America, and I got an answer for the individual. So we have an intentionality around this, and I'll tell you, I see it across all angles, from our global leadership to our North America leadership. There's nobody who's not committed to patients' feedback and also our customers' feedback. And again, it comes back to that listen first.
It's so inspiring to hear both of you guys' stories and to see how across different environments and different systems, at the end of the day, everybody's still, trying as much as possible to connect with the patients and make sure that the patients' voices are heard and taken into account. Again, more from the sort of life sciences, biotech background, I would say that I've been lucky to work in companies with very strong and vocal patient advocacy groups that do a lot of efforts to really bring in the voice of the patient, but also just organize a number of sessions where, patients either come in, virtually or physically, and we have a good conversation. And everybody, I've, again, working in smaller structures, but everybody in the company was welcome to join. And these are sessions where literally you get like 99% attendance, and the 1% is just because people couldn't make it for, whatever, they're sick or whatnot. I think it's always, it's been very valuable to have those sessions and always remind everybody from, the leadership down to the shop floor person why they're working, why they're coming in every day, what they're working on, how, what the hope is for the patient ultimately. And that's very powerful. And I think that also reinforces the purpose, reinforces the vision, but brings the team together and actually enhances performance at a company level, because we now all know and are reminded concretely what our common objective is and why, again, we're coming in the morning. So there are many different ways to do that. Obviously bringing in patients are one. I've been in companies that have hosted a number of charity events as well, where you can do these kind of things and really engage with the patient community. There's been a lot of effort done on internal communication as well to make sure that, again, it's not just a select group of people in a company that have access and have these interactions with the patient community, but we really sort of share that with the broad, pretty much the whole company. And so, again, everybody gets a chance to really be reminded and connect with the patients and on what we're trying to solve and what we're trying to improve. I also think the clinical workforce has a very important role in again, the context of biotechs that I've worked in, because they know the patients, they know the patient community, and they can be really good internal advocate in different instances for those communities. So I think it's extremely important. I think it's great to see that, we all come from different backgrounds and work in different industries and systems, but at the end of the day, everybody's really trying to bring in the voice of the customer and connect with the patient community, because ultimately that's all what we want to do is just improve and better patient outcomes. So.
Absolutely, and thank you all for leading that in your organizations. So I want to stop here and open it up if there's any questions in the audience. I see one, two.
Awesome. Thank you guys for the great talk and info. So a lot of what you focused on are, I'm going to call sort of like non-clinical leadership positions, which maybe makes sense for an MBA crowd. But I'm curious if you have any kind of meaningful insights or trends or observations on maybe like higher volume or blue collar kind of like non-clinical workforce. I think about, you probably have at United tons of folks in IT or call centers, and in life sciences, there's big investments in manufacturing, et cetera, and someone's got to drive the bus, right, for the mammogram, and engineers at Siemens and all that. Just curious, we hear the industry's hurting and reimbursements are down. People have choices of where they're going to work and what they're going to do. So curious if you've seen any impacts or have thoughts on kind of the higher volume parts of the non-clinical workforce.
Well, I can talk about manufacturing because I've got a lot of exposure to that, and especially here, I think this is a very hot topic in the RTP area. So I've worked a lot in cell and gene therapy. I can tell you right now there's a very intense talent war for people in operations positions, generally speaking. We talked about supply chain. I think it's very true for manufacturing. I know there's a lot of work done around thinking what are there new programs that could be developed to train those people on biomanufacturing, especially in sort of the more complex technologies and processing techniques. So definitely extremely important. And a lot of companies are investing in building out their own manufacturing suites. I mean, I've got a ton of examples, and if you just drive out there, you can see all of those new sites popping up. There will need to be a lot of people to operate those sites, and honestly, whether it's from a pure player or even CDMO perspective, there is a very intense competition right now, and a pretty big, lack of just workforce in general to be able to fill out those positions. So you mentioned manufacturing. I think that's a very good example where it's absolutely critical to get those non-clinical people working. It can make a huge difference from just every aspect of just being able to manufacture your products or being able to manufacture the products for other people. So yeah, definitely something, a big trend these days that is going on, and again, very local to here too. Obviously other places in the country, but definitely here a big challenge.
I would say, one of the biggest shortages in medical device and also at our hospitals is biomed engineering. I mean, now some will view that as clinical, but really it is a form of engineering. And I will tell you, service engineers, significant national shortage. Obviously not necessarily an MBA crowd type of role, right? But super, super important role. Obviously, I mean, it goes without saying, in a medical device company, lots of sales types of roles too, at all levels. And we need everyone to do that critical work, right? It's not about the sell. That's what's important. It's about enabling those breakthroughs in medicine. So I personally am not on sales, right? But I know that each and every day I can help our sales team to enable the breakthroughs in medicine. And so there are like sales enablement type of roles as well. There's many others. I think the other things I would definitely call attention to is there's still a huge need for project managers. Huge need, whether it's on the IT side or in other areas. We've got a ton of like project manager type roles that support our enterprise services teams, people that support. We've got a huge PMO office run by an alum from here. For example, I mean, we huge needs in those areas as well. And then the other areas that I would highlight is business development and strategy. I mean, Carnisa and I sit in an area called growth and innovation, and it's a great mix of clinical people and then non-clinical people. And I personally will tell you, I love when I work with a clinician. I wouldn't do my work if I didn't work with a clinician, and I'll tell you why. I'll give you the real life example. We were just at Northwell Health in Long Island earlier this week, and we were touring it. And when we tour, we want to be genuine, listen to the customer, right? And so we're going through, and their chief learning and innovation officer was so excited to show us their Center for Learning and Innovation. Now, I love to see those things. So does Carnisa, right? But we get in, and they're going to show us the latest and greatest sonography equipment, which I'm like, okay, I have 3 kids. I kind of know this. Carnisa gets right on, and she's using it, showing them how it's done, showing me, oh, there's fibroids there. And but here's the difference that made. Their chief learning and innovation officer said to me, I love the fact that you have somebody that actually knows what the team does. That's the difference when you have a clinical person in the room. And so I personally never like to go without Carnisa because they're going to actually appreciate us more when she's someone like her is there, because I'm just looking at it like, oh, this is really cool. But she actually is going to show them how cool it is. And the faculty see that, the others see that. So those are the things that I think make a difference.
So a big portion of the importance of filling the entry-level roles or other roles that are emerging out there, non-clinical or clinical otherwise, is because for clinicians to be able to work at the highest scope of their practice and their ability, there's other resources that can be doing different types of administrative work. All the panels today have talked about different forms of care team navigation, functional team navigation. We need care navigators, we need analysts, we need radiology technologists, we need all of these types of roles who are in such short supply right now that they're driving up the labor markets and across upwards and across other roles. So now, you can get MAs and rad techs that are getting paid like nurses, and traveling nurses that are getting paid more than doctors, and so we just keep moving the cost of the workforce further and further. Was there another question? I'm sorry, everybody.
I echo this. Thank you for you all being here and your insights. So my question is actually a little more personal to me, and I'm sure many people will echo this, but I care a lot about the clinical workforce. My mom's a physician, my husband's in medical school, and we talk about burnout and all of these things that they go through because of, lack of the physician workforce that we have and all of those things. So I'm wondering, how can the non-clinical healthcare workforce in particular be their best advocates to give them a more balanced life and a life outside of work? And I know, Geoffrey, you mentioned earlier about listening. Is there anything in addition, actionable items that the non-clinical workforce can do to help in that lens?
So I will tell you, and I'm actually doing a presentation in 2 weeks at a healthcare burnout conference. And one of the things that I'll be talking about there that's really, really important in this space is we have gotten away from debriefing. We need to do a lot more debriefing. And the non-clinical workforce needs to be a team of leaders as well and professionals that says we need to take time to talk about what we just experienced. We far too often are throwing our clinical workforce in after a trauma situation and not taking the time to allow them to process what just happened. And it's super, super critical. So whether you call it after action planning, whatever you call it, the military has shown time and time again that there's a benefit to it. And we can't just continue to throw them in. The reality of it is that's why people are burnt out. We're just not treating them like humans. I'll tell you, if you have not watched I Am Human by Stanford Medicine, watch it. It's a powerful video that shows you each and every one of us has a job every day in healthcare to be thinking about what another person is facing in their life, personally or professionally. And if we realize that with empathy and compassion, we can transform a workplace and not have burnout. Another actionable step is we need to actually not worry about providing food and worry about providing all these things. We need to understand whether our cultures in the workplace are actually supporting the needs of each and every one. And the first thing I would say that's actionable is get a strong sense if you actually have a sense of community and belonging. Do people feel they can psychologically, in a health and safety way,